what's the first thing that pops into your head? You probably think of compassion, right? A comforting presence when you need it most. And you'd be absolutely right. But what if I told you that behind every single one of those caring moments, there's this incredibly powerful systematic framework in action, a secret process that's way more like being a detective than you probably ever imagined. Let's pull back the curtain on this hidden framework.
We always associate the heart with nursing, and for good reason. It's all about that compassion. But you see that stethoscope? That represents something just as important, a really rigorous scientific approach to solving problems. It's the real engine behind modern nursing. It's where the art of caring and the science of healing just come together perfectly. And this scientific approach, well, it has a name, the nursing process. As you can see right here, it's a rational framework. It's an organized, systematic method that's designed for one main goal, and one goal only, to get the best possible results for the patient. You can think of it as the blueprint for literally everything a nurse does. Now, if this whole process sounds a little familiar, well, it should. Just look at this side by side. The nursing process is almost a perfect mirror of the scientific method we all learned back in school. It really is like being a detective. Assessment, that's asking questions, gathering clues. Diagnosis, that's figuring out the real problem. Planning is like forming a hypothesis. Implementation is running the experiment. And evaluation, that's analyzing the results. It's this non-stop cycle of thinking and doing.
So here's our game plan for this explainer. We're going to start with the framework itself. Then, we'll tag along with our nurse detective as they work the case, from gathering clues during the assessment, to using their toolkit, building a plan, and finally, taking action and seeing what happens. All right, let's dive in and take a closer look at this incredible framework that really guides every single move a nurse makes. Everything, and I mean everything, starts right here with the assessment. This is where our nurse detective starts collecting all the evidence, all the little clues that are going to form the foundation for the entire plan of care. The investigation is officially underway. And we're not just talking about taking a temperature or checking blood pressure. The key thing to get here is that assessment is holistic. It's a dynamic process that looks at the entire person, not just their physical symptoms, but their psychological state, their social situation, their financial worries, even their spiritual beliefs. Every single one of these is a vital clue. And you know, this process is also incredibly flexible. It could be that first triage assessment in a chaotic emergency room, or a really focused assessment on one specific problem. It might be a life or death emergency assessment, or a time-lapse one that happens over weeks or months. The situation changes, but those core principles of gathering data, they stay the same.
So how do nurses actually get all these clues? Well, they've got this specialized toolkit full of different techniques. Let's pop it open and look at a few of the most important ones.
First up, we have palpation. This is basically the skilled use of touch. A nurse's hands are like highly trained instruments. They can feel for subtle changes in skin texture, temperature, or spot a lump or a mass that you'd totally miss just by looking.
And this image shows it perfectly. There are two main kinds: light palpation for checking out what's on the surface, and deep palpation, where they use more pressure to check on the organs and structures deeper inside. It's an incredibly precise and valuable skill.
Next in the toolkit is auscultation, which is just the fancy word for listening. You know, with a stethoscope. They're listening in on the internal symphony of the body, the rhythm of the heart, the sound of air moving in and out of the lungs, and all the activity going on in the gut. So when a nurse puts that stethoscope on a patient's chest, they're listening for clues. Every sound, or maybe even the lack of a sound, is another crucial piece of the puzzle telling them what's really happening on the inside. Assessment is also about testing the body's mechanics. You know, how well can a person actually move? Nurses will test the range of motion in joints and check out fine motor skills. These tests can give them a ton of information about a person's neurological and musculoskeletal systems. And these tests can be anything from something as simple as the finger-to-nose test to check coordination, all the way to really specific diagnostic moves like Koenig's test, which can help spot a super serious condition like meningitis. Okay, so our nurse detective has gathered all the clues. Now comes the aha moment. This next phase is all about analysis, taking all that raw data and turning it into an actual diagnosis and a plan. This is where the real critical thinking happens.
Now, this is a really key point. A nursing diagnosis is different from a medical diagnosis. It's not about just naming a disease. It's about the nurse's clinical judgment of how the patient is responding to their health condition. For instance, the problem isn't just pain.
It's that the pain is causing anxiety, and that anxiety is leading to poor nutrition. It's about the whole human experience of being sick.
So, based on that holistic diagnosis, the nurse builds a plan. And we're not talking about some vague suggestion here. We're talking about a set of specific, measurable, and achievable goals. Not just feel better, but move from the bed to the chair 3 times today. It's a real, actionable roadmap to getting better.
All right, we've got a solid plan in place. Now it's time for action. This is the implementation and evaluation phase, where the nurse puts that plan into motion and then circles back to see if it's actually working.
But wait, before any action happens, safety is the absolute #1 priority, every single time. Simple, non-negotiable steps like washing hands, putting on gloves, and gowning up are the bedrock of safe and effective care.
And the range of actions or interventions is just massive. I mean, look at this list. It goes from something as basic as making sure you have the right patient, all the way to complex procedures like defibrillation and CPR. A nurse has to be skilled in a crazy number of hands-on tasks to make the care plan happen.
Okay, the intervention is done. The experiment is over. But the process isn't finished yet. The most important question is still hanging in the air. Did it actually work?
And that brings us to evaluation. You see, this isn't an ending. It's a feedback loop. The nurse goes back and reassesses the patient to see if the goals they set in the planning stage were met. If they were, awesome. If not, the process starts all over again with new data. It's this continuous, intelligent, self-correcting cycle.
So, the next time you see a nurse, you'll know. You'll know that just beneath the surface of all that compassionate care, there's a powerful scientific framework that's always running, assessing, diagnosing, planning, acting, and evaluating. So my question to you is this: what will you see differently now?